can lean into your own personal discomfort, say what needs to be said in a non-offensive way, the more you make the world a better place. Well, good afternoon, Facebook, Instagram, LinkedIn, YouTube, and even some of Guy's channels from the Alliance Against Seclusion and Restraint. Welcome all to this very timely discussion. This is Andy Prisco, and I'm coming to you right now from the hotel room in Little Rock, Arkansas, where I've been working.
Well, one of those freezes is happening here, Andy, so hopefully you'll be back in a second. Looks like we got frozen. Andy is in Arkansas right now, and will hopefully be rejoining us here in just a second. Unfortunately, as he shared with us as we were getting ready to get started, his internet connection was not working. So we'll give it a second, and hopefully he will become unfrozen. Otherwise, we'll continue going, and hopefully he will join us here again in a second. So we had planned that this could happen because this is always a possibility when you travel. At any rate, why don't we do this while we're waiting for Andy maybe to come back here? Why don't we start out with introductions, and I'll just give a little bit of background here to the topic. And it looks like we totally lost Andy, so hopefully he will be back here in a second. So Andy had asked me several weeks ago. Andy and I have had an opportunity to work together for several years, and I've gotten to know the work that he's been doing in Jumpstart Mastery, and likewise, I've shared with him about the work that we're doing at the Alliance Against Seclusion and Restraint. When we first connected, Andy has worked in many settings, far different from the settings we typically work in at the Alliance, but he had worked in forensic prison settings and acute psychiatric settings and healthcare settings, where he had done a lot of work around helping to reduce and eliminate restraint and seclusion. When we first began conversations about this, he was quite surprised to hear that these things were also happening in schools around the country. In fact, quite shocked, honestly, by the fact that these things were happening. So that kind of began a connection, and we've been connected now for several years. And recently, Andy had asked me if we might be willing to join him on his podcast. And of course, he's left us, but hopefully we'll be back. But he wanted to talk about this issue of restraint and seclusion in schools around the country. And I had talked to him about including a couple of our volunteers who also have been affected by the use of restraint and seclusion as well. And I'm just getting a message here from Andy that he's going to fix this. And I'm hoping, it looks like we're still live. So let me just type him a message here real quick. But what I'm going to suggest is that we just do some brief introductions here. And my name is Guy Stevens. I'm the founder and executive director of the Alliance Against Seclusion and Restraint. I got involved in this issue really because of personal experience. I have a son who was physically restrained, secluded, and traumatized in a public school. I didn't even know these things were even a possibility, and ultimately led me to questioning why they were happening and starting the Alliance. And I started the Alliance back in 2019. So, Cassie, let me go ahead and hand it off to you, and I'm going to type a message here to Andy and see if we can get him back on. But if you want to introduce there he is. Okay, we've been going on with the show here, but
thank you. God bless you guys. So, yeah, I'm in Little Rock, Arkansas, where the rain is plentiful and the Wi-Fi is not. So, thank you for being such a stalwart friend in this. As during my intro, I was just extolling how lovely it is that Guy Stevens and the Alliance and his crew of advocates have joined us on this very needed discussion. And I'm coming to you from a place where I'm actually working in a system right now that supports youth, both with psychiatric disorders as well as kids that are having difficulty finding placement in the foster system. And I'm here to address the restraint reduction need within this system. So it's happening in a number of places. Not only is it happening in public schools, which was to my astonishment, but my familiarity, as you know, Guy, is the need to reduce these procedures in so many other settings: adult corrections, juvenile justice, psychiatric care and services, health care. You and I, over these years, have formed some opinions about why we think this is happening, and I'm really excited to learn more from Sammy, Sarah, and Cassie, as well as you, about what's happening in schools and what we can do to raise awareness and see that the harm that goes along with these practices diminishes as well. Did everybody hear me okay?
Absolutely, absolutely.
Okay, great.
And
So,
I filled a little bit of space while you were fixing your
thank
technical
you.
issues there. Gave myself an introduction, and we were getting ready to kind of start with those introductions. So I'll hand it
Great,
back to
let's
you
do
to
that.
get
Let's
started.
Okay. My
right
name
next
is.
What's that?
I was going to go ahead and introduce myself next, if that's okay.
It is, please, by all means,
Yeah.
Kathy. Yeah.
All right. My name is Cassie Atella, and my background is actually in education. So I started off as a high school teacher, and I taught high school for 10 years before my son was born. But when I became a parent, my son actually experienced seclusion and restraint as a kindergartner and first grader, so 5 years old and 6 years old. And so I actually stopped working to keep my son safe so that he was not exposed to these, because I could see how harmful they were. And later, it inspired me to start an organization, which is now a nonprofit organization. It's called Michigan Advocates to End Seclusion and Restraint in Michigan, NSAR for short. I also helped to start a sister organization in New Jersey called NSAR New Jersey. And through those experiences, it just became clear that it would be helpful to do this in other states as well. So Guy has brought me on his team as the state coordinator for the Alliance Against Seclusion and Restraint. And now I'm trying to guide and mentor people to start projects through the Alliance Against Seclusion and Restraint to change policy and mindsets in the states across the country.
I'm delighted to hear that. I don't know if you knew that I'm originally from New Jersey.
Oh, no, I didn't know that.
Yeah, I went to Wayne Valley High School and witnessed 9/11, sadly, from my apartment in Bergen County in Midland
Wow.
Park, and did most of my growing up there. It started in Staten Island, but then finished in New Jersey, and I still have family there, of course. So
Wow.
thrilled to meet you, Cassie, to know
Yeah.
that in my home state you're doing this work. So
Heck
well
yeah,
done.
we are.
Yeah, terrific. Sammy, Sarah, anyone would like to go next?
Yeah, I can go next. I'm Sammy Patterson, and I am parent advocate here in Beaverton, Oregon. I first became aware of restraint and seclusion in schools actually when a sibling of mine was attending school. And when my son went into special education, it was a concern that I had that was still going on, and unfortunately it was. And he had experienced it. I continued to advocate for him, but through that advocacy, I found the Alliance and was able to work with Guy and get involved as a volunteer with the Alliance now in Oregon. And we're kicking off an Oregon project with Cassie through the state coordination, which I'm super excited about.
Sammy, I'm delighted to know you're in Oregon. I'm not far from you in the state of Washington.
Okay.
I've done and know a number of people at Oregon State Hospital where they're having some big problems right now with an excessive use of seclusion and restraint and experiencing a lot of violence, and have done some work with the Department of Public Safety Standards and Training there, as well as your crisis intervention team police officers. So glad to know that there are initiatives for ending restraint and seclusion in schools in Oregon. Of all states, they should be leading the way. So
They should. I agree.
I think what you're doing is great. Thank you. Sarah, please.
My name is Sarah Johnston Waugh. I'm in just outside of Rochester, New York. And I have a son who just turned 12 in June. He's been in special education since the first grade. The second grade, they finally did evaluations. And He went to a special education program, like out of district, because they couldn't handle him in district. And when he got there, he was being put in a seclusion room constantly, to the point where he was so traumatized that he asked them to restrain him instead. And he was being restrained every single day. And it got to a point where he completely withdrew and started just sitting in a corner all day long. So I reached out to Guy. It's like, what can I do? And that's how I got involved with the Alliance.
It's so important that people relay their lived experience with the harmful impacts of these procedures, particularly on children. As Guy knows, I'm in a lot of places where practices of seclusion and restraint are used in the management of aggression and violence within adults, and in some cases, there's serious mental illness or serious characterological challenges, and even then, we find a pretty significant distribution when we reduce these things. That results in the recognition that we were doing them unnecessarily. So, I think the first proposition that I would make to everyone in this room today, since you're in the public school setting and your children are served by educators, people who come to that field, I think, with a genuine desire to do good in the lives of children, they become presented with perhaps some behaviors that they have not really encountered much in the course of their life or their educational track to become a teacher. And this is resulting in a episode where a teacher or a teacher and an additional staff member or a designated staff member who does this engages in some kind of physical control over the youngster, and then in the school setting brings them to a place that reduces what is argued, reduces stimulation, reducing light, reducing sound. And there's some kind of mythological belief that that has a salutary effect on a human being. And what we now know, what is unassailably credible, what is indisputable, is that that's probably one of the most destructive things that can be done to someone who particularly. So, in your opinion, from your experience, when you learned that this was happening to your children and you engaged the staff of the school, the teachers, the caregivers, what was the level of sophistication of the answers that you got on this? What kinds of answers were you hearing when you said, I'm wondering why the hell you would decide to put my kid in a room and in some cases not even notify me?
I can jump
In
in.
reply.
I can jump in with that. It was very unclear to me in the beginning that this was even happening because they were calling it different things. They were calling it a reset or a time away. And in my head, I was imagining that this was happening, at a desk in the corner of the classroom. And when I finally asked the principal, where is this taking place? Because I was getting these notes back and my son started talking about this room. He told me it had skeletons in the corner. That was very confusing to me. I think it was like he was scared and he was trying to relay that. And of course he was 5. And so I was asking, like, where are you taking him? And they said, oh, this is the sensory room. And I had been taking my child to occupational therapy for a long time. We had a sensory room. It had swings and beanbag chairs, and it had an occupational therapist to help him move his body. And I thought, oh, great, you're taking him to a sensory room. That's wonderful. And it wasn't until a long time later that I actually got to see that room. And when I did, I was horrified that they have been telling me that this has been going on, but they didn't say we're bringing him into a small jail cell with, brick walls, and there is, no windows and absolutely nothing in it for him to calm himself or move his body. And we're just having the, door open 2 inches so that we don't have to call it an official seclusion. Yeah, I mean, by the time that happened, I was so just overwhelmed and horrified.
Yeah.
I didn't even challenge them. I took my child away and homeschooled. Like,
Yeah.
I didn't even know how to handle that. I was so frazzled at that point.
Yeah.
I didn't even get to get answers.
Yeah. I've heard, and Guy too, I'm sure, how many explanations have we heard with let's say, lexicon choices to try to mitigate the image of what this horror is, of putting a youngster against their will in a room like that, calling it some kind of going on that sufficiently results in some new capacity for self-regulation. Eastern State Penitentiary in Philadelphia was a facility that was built in the 19th century. It had running water before the White House, where the model of carceral system focused on complete isolation of everyone in there. If you had to leave your cell for any reason, you had a hood. The first completely isolated facility of its type, and Pennsylvania was attempting to proffer a model of carceral system that would reform people. This was discontinued because it was so completely damaging to human beings that the New York model ultimately prevailed, which is what we have today, is that you may have to go to prison, but you are with groups. We have congregate settings. There may be a need for some kind of removal from community contemplating the justice system, but you're with other people. If we learned that in the 19th century, what are educators using words like sensory room and trauma-informed care? How can they bundle this in the same sentence? I'm blown away by the lack of sophistication.
It was called the calm room. The calm room.
Yeah, there's nothing calm about it. Yeah.
Which I knew about. I knew about it, but they told me it was rarely used. Only in an absolute emergency.
Yeah. Yeah.
And now it's all about safety. That's what they tell you. It's for safety. It's for the safety of the other kids. It's for the safety of the staff.
Yeah. Wait till plaintiff attorney begins bringing these people on the stand and eating their lunch because their sophistication of answer is crude. In medical settings, we have to provide a far more robust explanation through specific behavioral observation of precisely what the person was doing to justify that level of controlling a human being. I'm astonished that
Yeah, we're cutting out again.
Yeah, we lost you here, Andy, for a second. So I'll just add something in the meantime while we're waiting for Andy to come back. Kind of back to the question. I think one of the things that I heard early on in my journey when I began to kind of advocate locally for change, when I began to ask questions about what had happened to my son, because, similar to your story, I remember our school having this probably 6x6 cinder block room with no windows. There was a door with a small wired window, and there was very dim lights, and there was a beanbag apparently when no one was in there. But other than that, the room was completely empty. And what the question that I would get so commonly was, well, what else do you expect us to do? And I think the reason, Andy, you acknowledged kind of in your lead up into this, and I agree with you. I mean, I think that most educators get into education because they want to help kids, they want to support kids, especially when we're talking about special education. I mean, many even have siblings, perhaps, that had a disability. Unfortunately, when you get into a system that is not well prepared, that doesn't have adequate training, and you get into a system where you're told to do these things, even though initially they may not feel like the right thing to do. A young teacher coming into their first classroom who's told, well, this is what we do when these children are having a difficult time, it might not feel good at first, but you think, okay, well, I guess it's what I have to do. And over a period of time, you begin to believe it's what you have to do. And you actually begin to see the children differently as well, because you begin to see them, somehow as challenging you. And all of that kind of takes this really good intent that people might have had and can lead it down a really, really tough road. I also wanted to point to Sammy, because Sammy, I know your situation really summed up well kind of what Cassie and Andy had both mentioned about kind of when you rename these things. So maybe you want to talk a little bit about kind of the situation you had.
Yes, and I really appreciate you, Andy, for having parents on here, because I relate so much to Cassie, and we're in separate states. And I think it's really important to have these conversations and have other parents hear what's going on, because you also kind of get conditioned into believing that this is the norm when you're isolated. My son, the name of the room they put him in was called the Red Room, and that was never anything I thought was okay. I had always thought that was horrifying and straight out of a horror book to call the room where he was isolated the Red Room. But the justification for it was the zones of regulation. He was in the red zone, and so he went to the Red Room, is what I was told and how it was explained to me. Luckily, the Zones has put out some new education about how that is not to be used. I'm really grateful for that. But yes, it was a sensory room, but called the Red Room. And like Cassie, again, we had been in occupational therapy for quite a few years. We had used the zones of regulation, and I knew that that was not a part of the zones of regulation and how it was supposed to be used. And I knew that's not what a sensory room looked like. We'd been to sensory gyms with occupational therapy, and that's not how we experienced them. And despite my best efforts to get our private occupational therapist involved, the school really cut it off. They did not contact her back when she reached out, which made it very difficult to have that wraparound care for our son within the private setting and the educational setting. But yes, the different names that they call them, I mean, there was the Red Room and there was also the Yellow Room at that school. But the Red Room was primarily where most of the trauma happened.
And Sammy, if I can give Sammy a little credit here, because
yes.
Sammy and I had a discussion about what was happening, and zones of regulation was never meant to be rooms where you were secluding or isolating kids. It was never intended for that at all. And because of the conversation Sammy and I had, I reached out to the developer of zones of regulation, and we actually had a really good conversation, which probably has something to do with them clarifying some of this as well. But they were horrified to hear that this program that they had developed was being used in this way by this school district, that it was never intended. So anyway, Sammy, I just wanted to kind of recognize, the advocacy, because when we do things, and all of us that are here on this call have been doing things. I mean, Sarah, I think about the event that you helped to organize last year in Rochester. You reached out to your local parent training center and managed to have them set up an event. And I came out there, and Diane Gould from PDA North America. So, the panelists that you have here today are parents, but they're also advocates that are doing things to help bring about change. And Sammy, just wanted to recognize that, because I think it's notable.
Thank God. Thank God for all of you. And as someone who spends time in a number of different sectors where we engage in these procedures, I've arrived at some conclusions about some common themes that I'd love to float to you, and you can let me know what you think. Whether it's a juvenile justice setting, a psychiatric care and services setting, a 72-hour inpatient evaluation and treatment setting, a total confinement setting that's civil, and people can present dysregulation or dyscontrol, and these procedures can be there. These are the things I generally see when leaders conclude that they have to stop doing this or it's not working anymore. Number one, staff report a need to control, situations that they weren't properly expecting when they came to the job itself. They were expecting one thing, and what's showing up is another. It gets experienced as that doesn't belong here, and we have to control it. So there's a conclusion about the presentation of behaviors of concern, that it has no place in the room. Secondly, that we don't have the time to be individualized in leading someone to self-regulation. We have to control it now in the service of the other people that we are serving. Eventually, decrying that leadership doesn't understand their dilemma, and they become at odds with the leadership of the facility because the leadership doesn't quite have the knowledge. So in the extremes, what this looks like are work shouldn't hurt, the leadership doesn't understand, we don't have time for this in the classroom, we need to organize and tell them that we need special programs for these kids to go to, we need to get them out of our classroom, we need additional people to come in here and de-escalate, get them out of the classroom. And the outcomes are almost always the same, where there's, let's say, a lack of progress as leadership indulges these things that the workforce says they need, and outcomes erode and deteriorate and become worse. Guy will tell you, because he had to restrain me practically verbally, when I learned this was happening in my own state, when Washington likes to consider itself the mantle of philanthropic ideological possession and nurturing and caring, and we have been allowing legally that kids with autistic experience are put in these rooms where they soil themselves, and we have teachers using trauma-informed care. I won't name the school district. I was getting in the car with my friend to go light the school district manager and board up about this issue. And when I get animated, if you can't tell, it can be pretty intense. So, I pretty much just wanted to chastise, who's the brainiac with the PhD who thought this was smart? Who's the person who's suffering from the delusion that any of this is therapeutic? Because that person's about to get mangled in front of everyone intellectually. And when I get that way, my message will get lost, and all they'll see is some zealot in front of them. So I've learned some valuable lessons over the years of attenuating how I present. The point being, these things must be brought to a stop, and what's driving their continuance really is naivete. It's people just really not knowing that there is some in managing your own emotional state and leading someone in, even when they want to become violent. And when they don't think that's possible, people don't know what they don't know. Guy, your thoughts on this?
Well, the first thing I'm thinking here is that, and my thoughts have evolved over time. When this was done to my son, you can probably imagine I was pretty upset. I was angry. I was not in a good place. But the deeper I dug, the more research I did, the more I understood why these things were happening. And the more I understand, the more I'm inclined to kind of point to the system failure. This is not individual failure. This is often a system failure. And we can support that by looking at data, because what you find is if you look at data around a state or around a district, whatever it may be, there are pockets where these things seem to happen quite a bit more than other areas. And it often comes down to leadership. It comes down to training. It comes down to kind of belief systems, whether you're looking at things through a very punitive lens. So I think that part of this is really recognizing that when you take well-intentioned people and put them in a system that does not provide them with adequate, support and resources, when they're being told to do things that don't align with what we know today. I mean, our higher ed systems are decades behind in terms of understanding behavior through the lens of the brain and the nervous system. We still do a lot really based on kind of compliance-based approaches that simply aren't working. They certainly aren't working if you look at the kids that these things are happening to most, because there are certain children that are in our schools that are far more likely to be restrained, secluded, suspended, expelled, subjected to corporal punishment. And these
Absolutely.
are children with disabilities, neurodivergent kids, Black and brown kids that already have a trauma background. So again, there is a systemic element of this here. And even though, quite frankly, I was pretty upset about the individual who had done this to my child, I think in stepping back, you've got to realize that there's a system problem. And if we don't fix the system problem, we're going to continue to have these issues happening.
I'd also say, and I'm curious from our advocates here and parents, was it your sense at any time that people in the school, as you were talking to them, had some awareness that this was wrong, but they were deliberately using language to try to mitigate the ill effect of the description, to try to turf responsibility? What was your experience of how much a principal, a school superintendent, a school district representative wanted to take ownership over the practice?
They don't. They blame the children. They blame the children. I get that consistently for 5 years that I've been doing this. Is he needs to learn that he cannot do that.
Yeah.
He needs to learn. He needs to learn how to behave. He needs to learn he has a disability.
Sarah, you know what's funny? I just want to get this remark in. People who say that have never been punched in the face and hospitalized by the person that they believe that about, most of the time. When the stakes are super high and you show up with someone who's living with disabilities, discontrol, and your message is one of, you have to find the capacity to self-regulate or you're going to suffer these consequences. They generally wind up in places where there are real violence. They end up in the hospital for presenting that way. And it's a widely known principle in any life or death circumstance that we do not show up with control messages. The hostage taker is not being instructed about how wrong their hostage taking is when lives are at stake.
I've used that exact example.
Bag of money, helicopter.
There's a hostage.
Yeah, it's like amazing. So anyway, yes. So please, Cassie, I think it was you that wanted to say something.
Yeah, I mean, you asked, do you think they were intentionally kind of sort of being deceitful about how they were covering up what they were doing? And I didn't think that at all, honestly, with the staff I was working with. I thought they had extremely good intentions. They were doing the best they could with what they had. They were aware that this was going to be very painful to me. I think they liked me. They knew that I was working very hard as a parent and doing everything I could. I was doing everything, I was cooperating and doing the things that they had asked me to try. And I was seeking help from all the people. And I think, they did tone down the language because they didn't, want to have it be so harsh and painful to me. But I don't think they were purposely being deceitful. I think they honestly believed that they needed to do this. They actually didn't know, like I didn't know, that their own nervous system was influencing him and the atmosphere that they were creating, because it was working for so many other kids and not causing them to have these kind of meltdowns. They didn't realize that there was anything that they were doing that was influencing my son to have these sort of meltdowns. They honestly believed it was internal to him. That was what the training that they had gotten had taught them. And, what the tools that they had received from that training, that was, the gold standard training, was that if it gets to the point where there's hitting, kicking, punching, where there's physical harm, this is what you do. And so they had created an atmosphere that was causing these meltdowns. They didn't know it was because of the atmosphere they created. Now, because of the language that's used, they're saying you're not going to get these points, or, you need to do this so you can have access to this, screen time at the end of the day. They were escalating, but they didn't know they were escalating. They
That's
thought
right.
they were trying to motivate him.
Yep.
And so then when it got to the point where he was, really freaking out, they had no idea they had done anything to influence that. And now that there's hitting, kicking, punching, that's the thing that justifies, I know what to do when there's hitting, kicking, punching.
Right.
I do this hold. And so they were doing what they were trained to do. They were doing what they were.
And they led it right there. They led it right to that spot. We could have been.
They didn't know.
Right.
They didn't know they led it to that spot. They were doing the best they could with the resources that they had at the time. But their resources were inadequate and wrong. And whose fault is that? It's wrong, and it shouldn't be that way. But I don't think that at least in the staff I was working with, they were not intentionally doing any of that. They were trying to keep everyone safe. They thought they were doing the right thing. They didn't know that secluding and restraining my child was going to cause future behavior that they were trying to prevent in the first place. They didn't know that doing that was like making their school more dangerous. They didn't know that.
Yeah, Cassie.
Yeah, I was just going to add, it's a matter of, if it's the only thing if it's the only tool you have, you can't imagine that there's possibly another solution.
That's right.
And I think one of the things that's interesting is that, I think Cassie put it really well. I think that most people that are doing this really are doing what they know, doing what they've been trained. I will say that it's not uncommon for us to have educators that reach out that are concerned about these practices. But, I think if you begin to do these things and you've been told that these are the things that you should be doing, you begin to convince yourself that this is the answer. Even if there might be a little twinkle of an idea that, well, maybe this isn't the best thing. But if you don't know another solution, no other solution exists. One other thing I wanted to hit here, Andy, because you mentioned something kind of stuck in my brain, and that was, thinking about the impact of all of this. One of the things that I think is really important to understand is that, Cassie kind of hit it a second ago. The trauma from having these things done to a kid is likely going to lead to an increase, not a decrease in behavior.
That's correct.
It's not just the trauma. Kids are injured. Staff are far more likely to be injured when they go hands-on. So if you can avoid going hands-on, you are keeping yourself safer, believe it or not. And of course, kids have died. We have had hundreds of instances of kids dying. Think about this, Andy. Kids dying in schools due to the use of restraint. There was a young man in Georgia a number of years ago, hung himself in a seclusion room. So the impact of these things is really, really significant. Now, one of the problems here in this space, Andy, that I think you know about, but there is no federal law that provides oversight to the use of restraint and seclusion in schools around the country. So every state is on their own in terms of what their laws say or what they don't say. And while some states are slightly better than others, even states that have very strong laws, often we find these things happening when they shouldn't be. And the truth of the matter is that, there's federal guidance that came out back in 2012 said you don't restrain or seclude unless it's a crisis. You've tried all other things that you can try to avoid de-escalation, and it's needed to avoid the threat of imminent, serious physical harm to the child or someone else. And as you know, imminent, serious physical harm has a legal definition. It is a potentially life-threatening situation. But more often than not, kids are restrained and secluded, not for the potentially life-threatening situation, but for non-compliance, for disrespect, for minor behaviors. And often it starts with and Cassie, you hit this in a very nice way. You've got a teacher or a staff member that, as a child is escalating, the things that they're doing to try to de-escalate aren't working. And they're actually further escalating the child, often leading to the crisis that then leads to the restraint or seclusion. So many of these things should never even be considered in the first place. And, again, if restraint or seclusion only ever happened in a school, in a case that could be, result in death, they would not happen hundreds and hundreds or thousands of times in a school district over the course of a year. They would be extremely unusual. And unfortunately, in many cases, these things happen daily in certain classroom environments.
Yeah, I witnessed 3 today. In person,
Yeah.
3. And a part of the journey that I'm on, there was a time I would become very outspoken during its occurrence to offer correction and alternative in a pretty animated way. And what I've learned is that because what I was essentially doing was attempting to discontinue unnecessary suffering. There's unnecessary suffering.
Oh, Sandy, I think we lost you for a second. Hopefully you'll be back in a second. I've actually got a thought on that too, which I'm interested to see where you're going with this. But of course, in the moment that somebody's restraining someone, giving them advice, they are probably very dysregulated themselves in that moment, and their ability to actually process what you're suggesting that they do or don't do is probably really limited in that moment. And that's one of the problems, is that these things, when you have a kid that's dysregulated, it's not the time to begin having a very logical conversation. When we're dysregulated, our thinking, logical, rational brain goes offline, and of course that happens to the adults that are involved as well. Sorry, and you disappeared, so I was just kind of filling a little space there. But
during the Wi-Fi break, I grabbed a piece of sausage. Anyway, my messaging was very intense to stop unnecessary suffering, and the journey that I'm on today is a little different. I have to carry the burden of witnessing unnecessary suffering as we make incremental change and get more people involved in change. It's like that African proverb says, to go fast, go alone, to go far, go together. I thought in my lifetime, in the areas in which I operated, I would be able to discontinue unnecessary suffering immediately. And I realized that when I got kicked to the curb, that I need to bring people along. So we are carrying a responsibility, all of us on this call. And I can't tell you how encouraged I feel to be with 3 parents who have become advocates, the great Guy Stevens and me, all in the same room together now, letting people know we realize may have thought this was okay. It's harming people. You may not know what else to do. There are people that do. Let us help you, and we will show you that what you think is not possible is possible. You can engage someone who is presenting discontrol and dysregulation and aggression without physically controlling them to lead them to better outcomes. You can do that in the moment. That's how we do it in hostage and crisis negotiation all the time. Why wouldn't you want to do it with a kid? We do that in the best juvenile justice and juvenile settings already. Why wouldn't you want to do that in a school? Your thoughts?
I said the same thing recently. Our other public entities that work with children here in New York have a completely different perspective on how to help children.
Sarah, where are you in New York?
Just outside of Rochester.
Okay. I can't name the agency. I'm just going to say I'm in some of New York's ongoing initiatives to reduce coercive intervention in juvenile settings. And I am impressed with, in many cases, the quality of leadership in New York systems, both in the city and outside of it. I'm wondering if you're to credit for that, Sarah. Thank you for the work you're doing in New York.
Thanks.
Well, Andy, one of the things that's interesting, and I'm thinking about this as you were explaining that, we often, kind of looking across the country, will find areas where there are better laws in place in juvenile justice settings than there are in schools, and that's really hard to kind of wrap your head around. The need for legal reform is really great, and I happen to notice the comments here, and there's a lot of comments happening there in the chat. I just noticed one from Brenda Davis, who's in Canada, actually, and I think we actually might have shared the petition recently about banning seclusion in Canada. She shares there in the comment that her son died in a seclusion room in 2024. I mean, this is not abstract. This is real, and the impact is real. And for Brenda, I mean, I appreciate the work that you're doing. We would do anything we can to support that work as well. It's really important to realize that individual parents, I mean, that's why I'm, you were just saying the three advocates, like, I'm a parent advocate. I'm just a dad. Yeah. I started this. I mean, Andy, I had a whole nother life before this started, and never had really planned this. But I think the importance of people, whether, you may not feel like you could do anything to influence a change in law. Meet Cassie, meet Sarah, meet Sammy. This work really can be meaningful. It's not easy, but I just want to applaud, anyone that's standing up to try to do something about it and don't feel like the system is too big to change. We have to do something to change these things.
We absolutely do. And raising awareness about the practicalities of it. One of the things that people don't think about is to get to seclusion, we have adults putting their hands on kids, moving them against their will, restricting liberty, restricting movement, getting into all kinds of legal areas. And we need courageous attorneys to speak up and say, where the hell does a teacher get off restricting my kid's movement if they were not actively engaged in assaultive behavior or self-harm? What precisely are you doing putting your hands on someone because of a compliance issue? Like, attorneys need to be challenging that in a really outspoken way. And I don't think we're seeing enough of that, frankly. And I'll just say it. We could be getting a lot more out of disability rights across the country and these individual offices and states to really go after that. I'm completely surprised that disability rights is not in as many schools as they could be.
Well, and some are better than others. I mean, we have P&As, protection and advocacy organizations across the country. Every state, has at least one, and sometimes multiples. But they're not all created equal. I can tell you, I've worked with some of the P&As across the country. I've worked with some fantastic disability rights organizations, and I've worked with others that don't have much in the way of resources and don't even make these things a priority. So, it's really tough. And again, I just want to come back to the point about, so much of this is really system failure. And while I had very little empathy for the people that were restraining my son when it happened to my son initially, in hindsight and kind of where I am today, I realized that these are people with good intention who got into a profession to help kids, who have found themselves in a system where they don't have the resources they need, where they've been trained. I mean, if the only tool that you've been given is restraint, and unfortunately, the way this training happens in schools. I mean, you know the story because you work in this space, right? There are crisis prevention training companies that are training people, and even if they're, I've done some of this training. I did the CPI training. It was 4 days. A lot of it was around de-escalation. They've introduced some neuroscience. They talk about some trauma. But what happens is that 4-day training that somebody like myself took, that was a train the trainer program, it goes back to the school and it's trained in half a day, and all they focus on is physical skills. And if that's all you teach people, that's what they're going to do. So, so much of this, again, comes from the fact that the systems are failing, and there is a big leadership component. When you find a school leader who is committed to reducing and eliminating practices, you know what you see? Practices that are reduced and eliminated. I mean, it makes all the difference in the world.
That's right. So, in these final moments together, because I'm feeling an extraordinary amount of energy and I want to end on a high note, we're all doing good work. We're coming together and learning about one another's work. Change is possible. Seclusion is bad. Controlling kids against their will is not good. It's not salutary. There's no evidence that suggests that. people might feel judged or criticized about it because they don't know. What do you say to those people in those final moments? I say we're here to help, release the shame or regret or personal sense of guilt that you might have because you think you're being fingered as someone who's malevolent. We're not saying that. We're saying that you can do it differently.
Right.
There are places where we're getting this work done, and people are far more prescriptive and committed to real concrete de-escalation skills. I'm in a state after I've been brought here, being brought here to address this very problem with kids and these staff have been trained in physical skills. They're now getting trained in something else. There are answers out there. To Sammy, Sarah, and Cassie, what do you say to these people who might be hearing what we're talking about here, and they're not necessarily on board with us, but rather they're feeling afraid to reveal that they've been part of the system, part of the problem, apprehensive about trusting that this is true, maybe entrenched in their worldview? What do you say to them, Cassie?
I'm just so extremely aware of how stressful being a teacher is, being an educator. They're under-resourced, both internally and externally. They're overworked. They're not getting enough sleep. They've been taught how to, make a good lesson plan and holding high standards, but a lot of them never saw these things until they got into the classroom, and their entire body and mind is telling them to make it stop. And they're doing what they were taught. And I think they believe that they need this, and they feel very threatened when we're trying to change laws and policies to take to make seclusion illegal and to restrict when you can use restraint. And they think that we're suggesting that we let kids hurt them and hurt others. And it's really hard for people sometimes to see the middle ground. When you're overwhelmed, it's hard to see the middle ground. But I live with the kid who you felt like you needed to seclude and restrain. I don't get to go home from work. Yeah. I am with him 24 hours a day, 7 days a week in all the stressful situations. And I could tell you it was not fair that nobody told me that when I was using some of these discipline strategies, it was causing him to attack me. Nobody told me that, and nobody told the teachers that. And nobody helped them understand, how to change what they were doing, to infuse joy into their day, to work on my own mindfulness, not trying to get him to breathe, trying to get me to breathe and to practice. And nobody told them that once this happens in kindergarten, there's long-term consequences. For the rest of their lives, they're going to be more reactive. The minute you start to correct them in a very calm way, they're triggered into that trauma because one time they got corrected and it ended up in a restraint. Yep. And so nobody told me that, and nobody told these educators that. And I am telling you, once you start to practice these new ways, you don't get hurt anymore.
That's right.
And your child can learn better. And when you start to pull back we think that we need to hold these high standards and be very consistent, and we have these demands on these kids. And once you start to pull them back and focus on the relationship and the joy, life gets better for everyone. There are no downsides. There are no downsides to this.
Cassie, so lovely.
Everyone.
So lovely. Thank you. Sarah, final thoughts from you. What do you say to these people?
I try to give relatable examples of how they can better understand what's going on in my son's head, and how our brains work. Because I think that's the big disconnect, is even if they understand a little bit about the neuroscience behind it. If you say amygdala, most people know what that means and what it does. But if you I give relatable examples, like, how your arm shoots out when you're driving and you slam on your brakes instinctively. You didn't do that purposely, right? It was your brain told you to do that. That's the kind of examples that I try to, like, you think about that stuff. This is what's happening with these kids.
Well
Their
done.
brain operating this way.
Sammy, I think he was getting ready to cue you up there.
Yes, I do. Today I heard someone say that we need to be a little bit less compliance to get this work done, and less compliant towards the system. And I spent a lot of time going back and forth with educators in the IEP room and IEP meetings, saying we don't do that here. We don't offer one-to-one support. You need to do it this way. This is how it's always done. And I wonder if some of those educators were just a little less compliant to the system, where we'd be now. I know that getting a little less compliant myself has helped me move forward in advocacy. So I think that is a good start, is questioning the systems. If it's hurting, then we need to question what's going on. What I found is me and my son, we were in a cycle, and it called back to an abusive cycle where things would be good for a while, and then something would trigger it, and we'd have another restraint incident or another seclusion incident. And it took a lot for myself to step back out of that cycle to even recognize what was going on before I could pull him out of school. And I hold a lot of guilt myself for letting it continue so often, to watch the cycle play through to see if I was sure that that's what we were doing. And I think some educators need to step back and see that they are in a cycle, and to get out of it, you do need to step back and start looking for other ways than what you're being trained in at the school level.
Great.
Andy,
great.
do you mind if I add something?
No, I was going to give you the last word, but I want to set you up with Guy Stevens, Alliance Against Seclusion and Restraint. The final word, please.
No, final word. Now the pressure's on. Well, I just really wanted to kind of address the question that you raised. And what I wanted to share with you is, and I think you know this, if you look at the Alliance, we've got probably 35, 40,000 people that are, kind of connected to us in one way or another on social media, through newsletters, through other things. And if you looked at our audience, it's intentionally very broad. We've got a lot of parents. We have a lot of self-advocates. We have a lot of teachers, paraprofessionals, occupational therapists, school administrators, you name it. And that's intentional, because we believe in bringing people together to solve these problems. I think a simple way to look at the question you asked, and I try to apply this to this work, and sometimes it's a challenge, but Cassie mentioned it earlier about teachers doing the best they can. And we, of course, believe that kids do the best they can. I believe the words from Maya Angelou are a great, guidepost here. Do the best you can until you know better. Then when you know better, do better. This is not about judgment. It's not about shame and blame. It's about how do we get on a journey so that we can continue to learn, continue to do better, continue to improve outcomes, not only for the kids that we're talking about here, but as you know, you can improve the outcomes for the kids and at the same time improve the outcomes for the teachers and staff. And Cassie hit this earlier as well. I think that you can actually make teaching more joyful again when you begin to move in these better directions, when you begin to have a better understanding. So I think there's a lot of opportunity here. And again, with any of this work, and I realize it can be difficult. It's difficult to have somebody come in and say, well, what are you doing? We need to do something different. But I think curiosity is really important to this. Sammy hit on compliance. And Sam, as you know, I think compliance is one of my least favorite words, because a lot of harm is done in the name of compliance. A lot of harm is done to kids, but it's also at the root of the problem that happens in education. Because, when you're compliant, when you do the things you're told, even if they don't make sense, you can do things that cause harm to yourself and others. And I think it's really important for us to challenge these things, whether we're educators, whether we're parents. I've always loved the words of John Lewis about, kind of make good trouble necessary trouble. We need educators, we need parents, we need advocates to make good trouble. This is necessary trouble. We can do far better than restraining and secluding children in schools. And again, the impact of these things can be a lifetime. So that was my thought on that question. And I appreciate the opportunity to join you today. And again, I think anytime we can collaborate and work together, even kind of across kind of work that we do that's very similar here, I think there's a huge benefit to it.
Well, yeah, and we have conversations lined up and scheduled for a number of things that we're working on. So it's it's a complete delight. I always feel warm and affectionate and very lovey-dovey about Guy Stevens wherever I go. So,
I've not had that description before.
well, that's how I feel, and you can put that in your pipe and smoke it, so to speak. So, um, to Sammy and Sarah and Cassie, what a complete delight to get to know you. I feel connected to you, and I hope that we can all keep coming together to like get under a big rock and push it up a long hill together and make the change that needs to be made. And each of us have our own motivations and reasons, and the universe clearly has brought us together to try to enlist more people in this work. Thank you all for taking the time to meet with us at Jumpstart and to lend your considerable network and membership in collaboration with us to share this message with the public. Thank you so very much.
Thank you.
Thank you.
Take good care.
You too.
We're doing this. Thank you so much for having us
We're
on.
doing it.
It's happening. We're doing
Yep,
it together.
it's happening. And the next time I come to New Jersey and you're there, we're going to go have calzone. Take care.
10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
More that you can lean into your own personal discomfort, say what needs to be said in a non-offensive way, the more you make the world a better place.